called a tibial stress syndrome. It's very common among athletes, and what happens when you start having throbbing and aching sensation in your legs. Often they heal on your own, but occasionally they do get worse and can lead to a true stress fracture or a break in the bone. A lot of times it happens because they change how they're training. They've been doing low intensity and they all of a sudden start increasing the intensity. The following are basically some of the things that do cause them. Swollen, irritated muscles, often due to overuse. Stress fractures, which are tiny hairline breaks in the bones. And a lot of people have flat feet or overpronate. And so the way your foot is when you step causes stresses in the ankle region, which can cause stress on the muscles and the bone, and in turn get shin splints. Shin splints are usually a dull ache. It's usually in the front or the side part of your lower leg. It's usually just during exercising. If you're running or jumping, you notice it, but if you sit down and you're just watching TV, it usually doesn't bother you. And it's usually painful to the touch, and it's usually along the inside part of your shin bone. Usually shin splints are diagnosed through physical exam. We usually get an x-ray just to make sure we don't see a sign of a stress fracture. Sometimes we get bone scans, and usually the bone scan shows that the bone itself is reacting and trying to heal itself in that area. Treatments for shin splints, it usually starts with decreasing your activities. Place ice on the shin. That will help reduce the pain and swelling. You only want to do that for about 15-20 minutes at a time, and you just do it for an hour on and off for about a week or so, and usually that does help. Another is using anti-inflammatories, so that helps take away the discomfort. Arch supports, a lot of times people have flat feet, and so getting insoles to help the way your foot lands when you walk will help. Use a range of motion and strengthening exercises to strengthen the muscles around the bone to alleviate the pressure on the bone itself. Sometimes we'll prescribe some sleeves or some braces to give you some support, and then sometimes if all that fails, then we get you into physical therapy to work on strengthening. Now if all these fails, then that's when we worry about bigger things like a true fracture, and that's when we sometimes get MRIs to rule it out. There's no fast rule about how long it takes to heal. It can take anywhere from 6 weeks to a few months for the pain to completely go away. Once again, the key is to rest and allow your body to heal the injured site. If it's not hurting, they can slowly build up their exercise program. If it hurts, it means they need to back off. Best way to prevent it is to be very smart about slowly increasing your activities. Also having good shoes, well padded shoes. Stretching is very important. Having stretching your calf and your Achilles tendon is very important. When those get tight, they put more stress on your shins and therefore cause shin splints. If you have shin splints, the smartest thing is to shut down and start cross training. Get in the pool and start swimming while your body has a chance to heal the shin splints, and then you can go back to doing your activities again.